Hey guys, congratulations. You've now got a bit of a further understanding of what Lyftogt Prolotherapy is, when you may be able to use it, and you're starting to think about how you might be able to incorporate it into clinical practice. Well, let's talk a bit more about setting those foundations for how you practice so that you're not just jumping into it without thinking about everything important. Now, we have that basic understanding, but really let's start talking about what it looks like in practice. And a good framework that we use to make sure we're covering off the big stuff is the 5 Ps. Think about your patient, your people, your practice, profit, and personal. Let's go through each of these now. Now, patient, this is what you need to consider. What are they thinking? What might they be feeling? How can you effectively communicate with them about prolotherapy, address their concerns, and ensure their comfort and understanding throughout the process? This is what you need to know and consider about people. Do the people in your team, such as the admin and everybody else that needs to be involved in some way, know what they need to do and how to do it? Have you provided adequate training and resources for your team to support the implementation of prolotherapy, including scheduling appointments, handling injuries, and assisting with patient education? When we're talking about practice, we want to know that you do have the right processes in place to support this, including patient information sheets and any posters or other information you might need. Now, do you have it set up in your point of sale system so the service can be charged? Have you developed clear protocols and documentation procedures for prolotherapy treatments? Ensured integration with your practice management system and established efficient workflows to streamline the delivery of the services. When it comes to profit, you want to think, what margin do you want to make? When will you order products? How will it impact cash flow? Have you conducted a cost analysis to determine pricing strategies? Assess the financial implications of offering prolotherapy and developed a plan to manage expenses and optimize revenue generation. And the personal, this is about you. What do you need to feel confident? What do you need to be confident doing your first one live? Have you engaged in additional training such as this? How about in person? What about mentorship opportunities to enhance your skills and confidence in performing prolotherapy? Identified any personal support needs or resources, and then establish a plan for ongoing professional development and self-care, of course. Now, to help you get started, we've provided a template for you. Before your next lesson, take time to work through the template and get a clear idea about the other things that we've talked about. Aside from the technical skills, which you've almost got covered, you then need to implement to make sure that you take this from theory to application. Definitely set the foundations for your practice, do it right the first time, and try not to learn from your mistakes, but learn from everyone around you as part of that supportive environment that we're offering here. Cheers.